Well, welcome back, everyone. Today we are here with Dr. V. Simon Abraham, a Lima Memorial cardiothoracic surgeon, and he's going to talk about open heart surgery and recovery. So firstly, doctor, can you tell us more about what open heart surgery actually is?
That refers specifically to the kind of equipment that we use, which is a very specific fancy pump to bypass the heart and lungs during the operation so that we can stop the heart so that we can work on it. There are certain types of operations that we perform. Most commonly, what people know as coronary artery bypass surgery for blockages in the coronary arteries. But we also perform certain other procedures such as valve replacement as well here at Lima Memorial.
Right. So what conditions or symptoms suggest that someone may actually require open heart surgery?
Yes. The most common, obviously, is coronary artery bypass, and those patients often come in with chest pain or chest tightness. Sometimes they can refer to it as heartburn. And think that, it might be stomach upset that they misinterpret and is actually due to the heart. So that's the most common. You also see patients who come in with shortness of breath when they exert themselves. And that really needs to be sorted out from other problems such as lung disease that can also cause those symptoms.
Right. So maybe what kind of open heart surgeries are maybe available at Lima Memorial?
Yeah. So the first and most common, I would say, includes about 70% of operations nationwide are bypasses for blockages in the coronary arteries, which are the arteries that provide blood supply to the heart. If you get a complete blockage, sometimes that can cause a heart attack. If they are just tight blockages, they can cause the symptoms we mentioned earlier, which are, chest pain or chest tightness.
Yeah, so what can a patient maybe expect before, during, and then also when recovering from open heart surgery?
So most patients that are going to have heart surgery are seen at Lima Memorial by one of our cardiologists, and then they'll have a workup performed that can involve several different things, but the most important are usually a stress test where you're often walking on a treadmill and they're monitoring your EKG. And then also patients will often have what's known as a heart catheterization, where a little tube is run up from the wrist and they shoot some dye into the coronaries looking for blockage.
Okay, so if someone thinks that they might be having some heart issues, how can someone just get in touch with or in contact with Lima Memorial to schedule a same-day cardiology appointment?
Yeah, that's one of the great things here at this hospital is that you can actually get in the same day, which is often unusual without going to the emergency room. You just go ahead and call the number on your screen, and we can get you a same-day appointment. And as I said, you don't have to go to the emergency room and wait for hours. Just call ahead to the number, and we'll get you in on the same day.
Wow, that is fantastic. Well, Dr. Abraham, thank you so much for joining us today. I really appreciate that.
Thank you. Enjoyed it.
All right. Well, don't go away because we have Born We Return.